and welcome to the medical show. I'm Dr. Grace. I'm very glad you are watching today. Today we are going to talk about heartburn and peptic ulcer disease. Have you ever had heartburn, or do you frequently have it? Have you had stomach ulcer before, or do you have it at the moment? Take a few minutes to listen to this few discussion, and I'm sure you will understand at the end what causes it, what you need to do, and how you can prevent it. Heartburn is when you have pain in your chest, like a burning sensation that you feel at the mid part of your chest, and sometimes it can move to your neck, to your throat, or to the angle of your jaw. Peptic ulcer disease is a common name that is given to stomach ulcer or to duodenal ulcer. What do we mean by this? When there is breakage in the lining of your stomach wall or the first part of your small intestine, which is called duodenum, it can lead to what we call ulcer. And this is called peptic ulcer disease. Peptic ulcer disease is a curable disease. What are the risk factors for it, or what can cause peptic ulcer disease and heartburn? For heartburn, if you are very used to taking spicy food or citrus food, if yours is your weight, you are on a very high tide on your weight, or pregnancy, or you are very used to lying down very quickly after food, or you eat late at night, or yours is smoking. These are risk factors for heartburn. When we talk about peptic ulcer disease, there are causes of peptic ulcer disease or risk factors, which are infection from H. pylori, which is called Helicobacter pylori. This is a bacterial infection that is present in the digestive system, and it invades the stomach wall and can cause inflammation or swelling, and then which leads to ulceration of the stomach wall. And it also increases the acidic content in your stomach wall. When this microorganism is present, it can really cause the peptic ulcer disease. But thankfully, there are antibiotics that can be taken to help treat or eradicate this microorganism. What are other causes, or what are other risk factors? Others are non-steroidal anti-inflammatory medications such as naproxen, such as diclofenac, ibuprofen, and many more like that. Other things are genetics. When there is research has shown that if one of your family member has peptic ulcer disease, you are at high risk of also having peptic ulcer disease. Also, another risk factor is smoking or alcohol abuse. Alcohol abuse limit or decrease the rate at which the ulcer is being healed, so it slows down the healing process. Another is psychological stress, and sometimes you have seen it in a tumor called gastrinoma. Now let's talk about the symptoms of peptic ulcer disease. What are the symptoms of peptic ulcer disease or stomach ulcer? When there is pain, which is called burning pain, epigastric pain, pain in your epigastric region or in your stomach wall, and that causes hunger pain. I've seen a lot of people will tell you that they feel the pain more when they have just eaten, and that is typical for gastric ulcer or stomach ulcer. Just maybe when you have eaten for after some hours, and that is duodenal ulcer. When this pain is always there that you have to eat for you to get better. When you eat, the pain disappears. It is more of duodenal ulcer. The symptoms are similar, and that is why they are grouped as peptic ulcer disease together. What about for heartburn? Heartburn on its own is a symptom. It is a symptom of gastroesophageal reflux disease. When you have reflux of your food, of your acidic content from your stomach into the esophagus, it can cause gastroesophageal reflux disease. Heartburn is also a symptom of peptic ulcer disease. For people who have gastroesophageal reflux disease, they also have other symptoms like metallic taste in their mouth, and also they feel sore throat or hoarseness of their voice. Sometimes they have chronic cough. Are there ways we can diagnose this? Yes. When you have these symptoms, please go to the hospital. Visit your primary care physician. You'll be tested. You'll be asked questions and examined properly, and then we'll be able to know what what type of ulcer you are having and be given appropriate medications. What are the treatments for it? Usually there are over-the-counter medications you can take, like antacid, that helps your pain. But remember, prevention is better than cure. And that is why you have to prevent and do some of your own lifestyle modification, such as reducing your weight if you are on the overweight side, reduce your smoking habit or stop smoking, and if possible for you, limit your alcohol use. And do not lie down immediately after eating. And try to avoid as much as possible to eat every meal before going to bed. And also avoid foods that can trigger heartburn. If possible for you, stop the NZ medication. What are the complications of peptic ulcer disease? It can cause perforation, it can lead to bleeding, and it can cause bleeding, and that is why sometimes your stool can become dark in color and it can cause obstruction. So I hope you understand today the topic we have discussed. If you have any question or any comments, please link down below and I'll be very glad to answer your question. See you next time. Bye.